Good afternoon, and we'd like to welcome you all who have joined us today to the Healthy Flint Research Coordinating Center webinar on coronavirus. The Healthy Flint Research Coordinating Center is a multi-institutional partnership led by a strong community core, academic partners at the University of Michigan Flint, University of Michigan in Ann Arbor, and Michigan State University, the Flint campus. We are streaming live also, so we'd like to welcome all of those of you who have joined us by YouTube, and I'm even mindful that some of you have joined us by phone. Today, our nation is facing very challenging issues that we cannot ignore. We're concerned about what is happening all over our nation and encourage everyone to be aware of what is going on. We want you to be cautious and mindful of the times in which we live. And our goal today is to be able to inform you and provide you with information that will help us make informed decisions with the intention of protecting and saving lives. For those of you that are joining us by phone or YouTube, we have a team of community partners serving as panelists. And let me just back up a minute. I want to welcome you. My name is Yvonne Lewis. I am your moderator for today. I'm also one of the co-directors of the Healthy Flint Research Coordinating Center, representing the community core. And we welcome you. If you've joined us by YouTube and you've joined us by phone, we do want you to know today that we have an extraordinary group of panelists that are going to be helping us to answer any questions that are going to be raised today. Now, for those of you that cannot see their names, I'm just going to let you know who's here. And if those of you are joining and you want to call us, I'm going to give you, text us a question that you might have, since you can't actually tune into the Q&A button. I want to give you a number in just a moment, but we're excited to have Dr. Deborah Holden, Michigan State University, who is also a co-director of the Healthy Flint Research Coordinating Center. Gary Jones, who represents the Office of Governor Gretchen Whitmer. He is our Flint community connection, keeps us well informed about what's going on. We also have Kim Van Slyght, who is with the Genesee County Health Department, along with Suzanne Kupel with the Genesee County Health Department. Excited to have Kirk Smith, who's the CEO of the Greater Flint Health Coalition, Clarence Pierce, who is the CEO of Hamilton Community Network. We have Dr. Lawrence Reynolds, who is with the City of Flint as the Chief Health Advisor. We'll also have Sharonda Grigsby, Doctor of the Office of Equity and Minority Health from the State, Michigan Department of Health and Human Services. Dr. Susan Wolford from the University of Michigan in Ann Arbor Medical School. Nicole Anderson-Smith from the Greater Flint Health Coalition. Dr. Rick Sadler, MSU Division of Public Health. We also have Tracy Jackson representing Metro Community Development. And we'll hear from in some of these today, particularly in our session. So we want you to stay tuned to hear from them. If you are able to go to the bottom of your screen and you see that Q&A button, we want you to begin now putting questions in. Those of you that attended last week may have thought through the week about a question that you may have for some of our panelists today. Feel free to put those questions in, because they are here to respond to those questions for you. In addition, that number that you can call to text a question is 810-835-2130. Again, that's 810-835-2130. And we'll be mindful to put your questions into our queue for answering them today, if possible. We acknowledge and appreciate those of you that continue to share the value of the webinars that in your work to provide information and access to resources to community members. We had one of our members today say they're sharing the information with their family members, which is really critically important. Yes, and we also want to be sure that if you gain important information about this and related issues that you want us to share, please feel free to contact us. Our information will be provided later in the webinar. Today we have a full webinar for you today. We're going to focus in on personal protection during this time and while we're preparing for a reopening. We're going to hear again from the state, from the governor's office about some reopening activities that are going on. We got a key focus today on testing and contact tracing, as well as how important it is for us to have medical homes. So we're going to start our webinar this afternoon with Dr. Deborah Holden. As I mentioned to you, she is one of the co-directors of the Health and Flint Research Coordinating Center. She's also the Associate Dean for Public Health Integration at Michigan State University. Dr. Deborah, this critical question, you started off talking to us about it last week. What do we do to protect ourselves during this reopening process?
Great, thanks, Yvonne. So there's just a couple of quick things I want to leave people with, because there's a lot you can do to increase your own personal protection during this reopening period. The first thing that you can do is use personal protective equipment. People keep talking about PPE. We should be using personal protective equipment when we are out in the world. Also, it's important that people continue to practice, I like the term physical distancing, and I understand that social distancing encompasses a bit more, but people should continue to practice those things. People should continue to work on boosting their immune system. And the reason that I mention this is because it's important that if you are exposed, you've given yourself the best fighting chance to recover. What does that mean? What can I do to boost my immune system? Well, if you're a smoker, you should do your very best to quit smoking. You should limit your drinking. You should try to get in 30 minutes a day of some type of physical activity. And it might not be conducive for people to go on a jog in their neighborhood or ride a bike. So I tell people you can do things. I do a daily practice now of sweeping and mopping my first floor of my house. And I say that I mop like no one's watching. I'm getting my workout, moving around and mopping in my house. Also, now more than ever, good nutrition. Eating high nutrient food that are high in vitamins and minerals, healthy lean meats, supplements if you have any extra dietary needs that you can augment with supplements and vitamins, also recommended. Stay abreast of the current information. A lot of what we talk about is right now, best knowledge at this point in time, and it's important. Places like the webinar, the local health department, our colleagues in the City of Flint and in the governor's office are our credible and trusted sources of information. And then I always encourage people to make choices that make sense for you and your family. And this one is an obvious one because people say it, but I know if I don't say it explicitly, Dr. Reynolds is gonna get me. Continue to wash your hands. And our moms already told us that, wash your hands, wash your hands. So even though that's not on the slide, I felt like it was a given, but I wanna state it explicitly. Do know that there's some very important local efforts that are happening. I specifically wanna highlight on the next slide, the Community Foundation of Greater Flint has formed a local task force. That task force is working in partnership with the governor's task force. We originally started off sort of focusing on racial disparities. We've kind of expanded that and are not just trying to figure out what can we do to deal with the differences that we see in people, but how do we actually deal with the systems and structures, many of which predated COVID-19, that give rise to those disparities. So we've done a bit of rebranding. It's now called the Greater Flint Corona Task Force on Racial Inequities. You can go to the Community Foundation site. You can find out about what's happening. Many on this call are part of that committee, that task force, or are a part of the working subcommittees doing the work. The last thing I wanted to point to is that there is this Greater Flint Urgent Relief Fund. They've given out, I believe, close to $1 million to date. If anybody has questions about that, you can email relieffund, RELIEF, FUND @cfgf.org. And they are making small grants to a variety of community-based organizations and community partners to help fill in some of the needs of our community. I'm gonna just take one more minute, Yvonne, because this question has come up many, 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 many times.
Absolutely.
All right, so I wanna just show my folks real quick. This is how you put on gloves. I'm gonna show you how to actually use your personal protective equipment. First thing, before you put your gloves on, let me turn my background off. Let's hope my house ain't too shabby in the background. Okay, great. First thing to do, you wash your hands. Most people don't know this. The point is to put a clean hand in the glove. So first thing you do is you wash your hands, okay? Then you apply your gloves. Now you wanna understand, once you got your gloves on, Whatever you touch is on the surface of your gloves. So if you go in the store, do not put your gloves on and then take that gloved hand and go to your car and grab your car handle. Because if you do that, what you're doing is whatever's on the outside of the gloves is now on your car handle. Okay? You have to change the gloves in between exposures and in between places. Remember, virus could be on the outside of the gloves. So how you take your gloves off is you pinch the glove with one hand, you take it off, see how it kind of curled up? And then you take your clean hand and you stick it underneath. You're not touching the outside of the glove, and you roll it down. And now it's all in this one container, inside out, and you throw that in the trash. And then you sanitize your hands again. That's how you do your gloves. It's really important. I worry about cross-contamination, and I know that people have been sanitizing the gloves with hand sanitizer. That is not a best practice, and gloves were not designed for that use. So let's not have the gloves increase risk. Last quick thing, my wonderful assistant, Tay Blair, has made me and many others these homemade fabric masks. You should be applying your mask from the strap. You put it on, again, don't touch the front of the mask. You take the mask off the same way you put it on, by the straps. If you put the mask on like this, and then you take it off like this, whatever was on the front of the mask is now on your hand. I go to readjust my glasses, push my hair out of my face, and I've contaminated myself. That's my spiel. My time is up. I hope this was helpful for people. It's not only important to use personal protective equipment, but using it properly is critical as well. Thank you so much.
Thank you, Dr. Deborah, because one of the questions was about using gloves. And so we appreciate you sharing that information with us today. And we hear so much about the importance of personal protection, but we really wanted to bring you some real specific details, because what we're going to talk about next is very, very important. And again, we won't be able to get it all in today, but we're going to cram as much into this next few minutes as we can. Most of us heard Gary Jones last week, and Gary gave us like just so incredibly wonderful information. And one of the things, Gary, just to start off with, we know you are our Flint guru based upon the issues that are happening in the state. And one of the things we talked about last week was the executive order about how long we would be in this safe program. So can you talk a little bit about that? And then we'll talk about some other ways to make sure we can connect with you.
Yeah, so actually, Yvonne, if I could start by this, normally when I do my updates, I like to, just give the most updated information as far as cases are concerned, and then just sort of brush through with just what happened since the last time that we've met here, just to give, people the most accurate and updated information. And so I tend to start out by listing like the total confirmed cases that we are now at in the state of Michigan is at 56,014. Total COVID-19 related deaths are now at 5,372, and total of recovered COVID-19 cases are 33,168 as of May 22nd. And just as a note, recovered is defined as the number of persons with the confirmed COVID-19 diagnosis who are alive 30 days post-onset. Recently, the governor sent a letter to President Trump requesting an extension to utilize the Michigan National Guard through July 31st. So by sending this letter requesting this extension, it helps to combat the spread of the COVID-19 virus. The Guard has been instrumental in flattening the COVID-19 curve in Michigan by performing testing throughout the state, distributing personal protective equipment, food and medical supplies, providing warehouse support, disinfecting public spaces, and assisting the Department of Health and Human Services with testing. Also recently, Michigan will add online purchasing and free quarantine care kits and additional supports provided for people who need to stay at home. So in order to make life a little easier on families who need to stay home during the pandemic, Michigan families who participate in the Supplemental Nutrition Assistance Program, or SNAP, soon will be able to buy their food online from 2 national retailers. In addition, the state is also rolling out quarantine care kits. with essential goods for families with low and moderate incomes who are in quarantine or in isolation. Also, recently regulated utilities extend protections to assist vulnerable households until June 12th. So these are Michigan's relegated utilities who have agreed to extend through mid-June the shutoff protections, flexible payment plans, and other options they've offered to help customers struggling to pay utility bills because of the impact of the coronavirus pandemic. Utilities, including the state's two largest, Consumers Energy and DTE, have extended these protections for vulnerable customers through June 12th, following the governor's extension of the Stay Safer at Home order. Also, health insurance enrollment deadlines approaching for Michiganders who either lost a job or experienced a drop in income. So the deadlines are fast approaching for people who lost their health insurance due to layoffs, reduced hours, or a change in income during the COVID-19 pandemic to take advantage of a lower no-cost healthcare option available through the health insurance marketplace. So consumers in these situations must sign up for health insurance within 60 days, which is coming soon for people who are impacted in the earlier weeks of the COVID-19 response. Also, this is something that a few folks have asked me about. The Secretary of State branch offices are to reopen June 1st by appointment only. So updated renewal mailers will provide additional information on the easiest means of conducting transactions, but the Secretary of State has decided to reopen June 1st by appointment for essential transactions not available online in order to continue to balance the need to provide critical services and protect public health. Also, recently, the governor signed an executive order expanding COVID-19 testing sites. So by expanding the types of medical personnel that can order a test, creating a new category of community testing sites that offer testing to anyone with reason to be tested without an advance order or without charging an out-of-pocket cost to any Michigander. The governor also announced a new online dashboard that visually illustrates COVID-19 risks and trends in Michigan, providing residents with important information about the pandemic status where they live and work. And you can find this dashboard at mystartmap.info, mystartmap.info. Governor also has taken action to continue protecting Michigan families and workers from the spread of COVID-19. And by doing so, an extension of the Safer at Home order until June 12th. The governor also is protecting Michiganders from the spread of COVID-19 by extending the temporary closure of certain places of public accommodation, such as theaters, gyms, and casinos. Also, the governor recently reopened auto dealerships and retail businesses by appointment, in addition to authorizing non-essential medical, dental, and veterinary procedures. So by signing this executive order to reopen retail businesses and auto dealerships by appointment statewide beginning May 26th, as part of the My Safe Start plan, the governor also lifted the requirement that healthcare providers delay some non-essential medical, dental, and veterinary procedures statewide beginning today, May 29th. And the order also authorizes small gatherings of 10 people or less starting immediately, as long as participants are practicing social distancing. Just as a flag for awareness, today the most updated information will be given at the governor's press conference at 3 p.m. So make sure you check that out. And the best website for everyone to keep updated with everything is michigan.gov/coronavirus.
Thank you, Gary. We want to just take a step back to the previous slide for your introductory slide, because we want to focus in on a couple of things for our members that are participating in our webinar today. Gary, you give us great information, and one of the things we want to appreciate is the fact that you're telling us how many people are surviving, because that's going to be critical in future conversations. But we also want folks to know that they can get on your email list to get all of this information. So we put this up on the screen. Gary's email is available. And so Gary, would you just give us your email address that you would like us to, I want you to see so those that are not on can hear it.
Yep, so my email address is jones g9@michigan.gov, JONES, the letter G, like Gary, and then the number 9 at Michigan, and Michigan is spelled out completely, at michigan.gov. So yeah, if you are interested in getting on that email list, what I usually try to do, Yvonne, just because there's so much information that comes out and it comes out at such a fast pace, I usually try to send out like an update on at least on a daily basis, and kind of summarize like a lot of this information. But there'll be links inside of the email if people want even more information than
And
what
I
is
and
summarized.
I can contest you are faithful at getting those emails out to everybody. But you also talked to me about the fact that there are some times within the particular announcements, if there's some things that an organization or an industry wants to know in detail, they can call you directly
Yes.
and get that information. So Gary's phone number is 517-282-3913. Again, that's 517-282-3913. And he's open to you calling him and getting more detailed information.
Actually, you know what, Yvonne? I think it's 517-282-3193.
Uh-oh. 282-3193. We'll have to make that correction. Thank you. So Gary, let you give your phone number out again.
I had to check it myself. I just had to look like, that sounds right.
Okay.
But yeah, 517-282-3193. So definitely, if there's some more, if whatever information that you're seeing is coming forth, from the governor's office, and you do have additional questions, definitely give me a call. And if I don't have an immediate answer for you, I'll do some research and get back with you.
Thank you, Gary, so much for that. And it's really important for us to continue to be reminded that our state is working closely with our city and with our county health department. And the county health department is really critical to us because we're now talking about testing, we're talking about contact tracing, and all of these are critically important. And last week we received a number of questions as Kim Van Slyke Smith was sharing with us, and she's a nursing director at the Genesee County Health Department. She was sharing with us about contact tracing. But before we get to that, there was an event that happened last weekend, Kim, that I know you can tell us a little bit more about, because it's going to be happening again this weekend. There is a special free testing opportunity for our community residents. So Kim, can you tell us a little bit about that and the distinction between our regular sites for testing?
Good morning, Yvonne. Thank you. Yes. So last weekend and this weekend, the state, in collaboration with the state, the Michigan State Police, the Michigan National Guard, Shiloh Missionary Baptist Church, the City of Flint, and we at the Genesee County Health Department offered free COVID-19 testing. No appointment is necessary. Last weekend it was drive up only. We had a wonderful attendance. We tested 223 people on Sunday last weekend and 299 people on Monday, the holiday last weekend. We will be testing again this Saturday and Sunday, again, Shiloh Missionary Baptist Church, 2120 North Saginaw Street. The flyer that you have there, Yvonne, we had to adjust that a little bit. The entrance is actually off of Newell Street, which is the side street just north of Hamilton. But it's there are Flint City Police on site directing traffic, so everybody will get directed to the correct place. So this testing, how is it different from the testing sites we already have? As I said, you don't need an appointment. You don't have to pre-register, although you can fill out the registration form if you have access to a printer. It is available on our website, www.gchd.us. You can print the form out, have it filled out before you get there. It will speed things up a little bit, but we do have the forms on site as well. Like I said, no appointment. There's no screening criteria. If you feel you need to be tested, you can show up and get tested. The times for Saturday and Sunday are 11 a.m. to 3 p.m. We do have to cut off testing right at 3 p.m. We have a courier that comes from the lab to pick up the test, and they have an appointment, and it has to be delivered and received to the lab at a certain time. So we do have to abide by that time frame, but it is Saturday and Sunday, 11 a.m. to 3 p.m. at Shiloh Missionary Baptist Church on the corner of Saginaw and Hamilton.
Thank you, Kim. And you're going to come back in a little bit and talk to us. We thought it was important that we put this out front because, of course, community members heard about it, and it was a short window last time. And we wanted to be sure we clarified the difference between this testing that will happen this weekend and our other sites that we've been talking about all for the last few weeks. So Suzanne Cooper, also with the Health Department, give us an update, if you would, please, on the current sites, as well as you're going to tell us something really important about what happens even after people are tested.
So Yvonne, I'm going to tell you a little bit more about the sites, but let me first give a quick update on some statistics and some health department news. Just a reminder to everyone that we post to our website, www.gchd.us, every day at 2 p.m. the latest statistics for COVID-19 in our community. And as of our posting yesterday, we had 1,986 COVID-19 positive test results and 245 deaths. Again, it's not reflective of all the likely cases of COVID-19 in our community because we've had limited testing, and that's why the testing that's going on in our community is so important. So I want to remind everyone that we have quite a number of sites that are already up and running and will continue beyond this weekend, and that there are more in the works that will be coming online shortly. We have a number of locations that are staffed by local pharmacies. We have the Rite Aid in Swartz Creek. They are offering testing daily from 9 a.m. to 5 p.m. And at the Flint location on Clio Road, they are testing Monday through Friday, 10 a.m. to 8 p.m. to accommodate people who work, and Saturdays and Sundays, 10 a.m. to 5 p.m. The screening process is by appointment on the website for Rite Aid. We also have a Walmart site that is located on Corona Road in Flint Township. That site is open from 7 a.m. to 9 a.m. Monday, Wednesday, and Friday, again by appointment. And that is also a screening process that is done on their website. Kroger is providing testing in Grand Blanc, and the Grand Blanc location is Grand Blanc High School's parking area. They are providing that testing Monday through Thursdays, 10 a.m. to 4 p.m. And again, the screening process is via the website. Michigan Health Specialists are providing testing at 2 locations, one in Burton and one in Flint. They are doing that by appointment Monday through Friday, 9 a.m. to 5 p.m. And Hamilton Community Health Network provides testing on Tuesdays and Thursdays at the North Point Clinic and at the Burton Clinic. Their screening process is online as well. They also have a call number, which I will share again, 810-406-4019. Again, 810-406-4019. The Burton location will be moving next Tuesday to the Burton Fire Station that is on the corner of Bristol and South Saginaw. So we want to make sure everyone is aware of that and make sure that you're prepared and are headed to the right location. From the health department, I want to remind everyone that our McCree South building is closed to the public, but we are providing service, so please don't hesitate to call us, and that we're providing all of our services at Burton by appointment for WIC, family planning, immunizations, and sexually transmitted infections. So we've talked a lot about the testing location at Shiloh, these other testing locations. We want to remind everyone that also posted on our website is a fact sheet from the Federal Drug Administration that has the information about the various types of testing that are done. And we want to remind you that in our community, there's a nasal pharyngeal swab that's being done at the Shiloh location with Michigan Health Specialists and with Hamilton Community Health Network. But the Rite Aid, Kroger, and Walmart sites are using a nasal swab, and they are having you do this self-administered nasal swab under the supervision of a pharmacist. So that guide will give you a little bit more information about the testing process, so you're prepared for whichever location you choose to go to. I also want to remind you that on our website, there's information posted daily, and we are updating regularly the information about reopening guidance. So we encourage you to check on our website and get those updates. So you've gone to a testing location, you've had the test conducted. What do you do next? I'm going to pass it back to Kim to share a little more information.
So all of the locations that are testing, including our testing site this weekend at Shiloh, will give you information on how to access or when to expect your testing results. Usually it is within 7 days. It takes that long because it takes at least a day to ship the samples back to the lab, and then to be processed by the lab and run and resulted by the lab, and then the results to be sent out. The very quickest that we ever get them usually is about 48 hours. While you are waiting to be tested, if you're being tested because you are symptomatic or because you've been exposed to somebody with COVID-19, then you need to isolate yourself at home, and you need to protect others around you just in case you do test positive. If you are a healthcare worker, the rules for you might be a little bit different. You need to check with your place of employment. And then if you are a positive test result, then you would need to isolate yourself at home and try to protect your family members as much as possible, keeping yourself to your own bedroom or a certain part of the house, making sure you wash your hands frequently, making sure you wipe down frequently touched, high touch surface areas, door handles, counters, bathroom surfaces, and let others, if possible, prepare the food that your family will be eating. If you need to be the one preparing food, make sure that you are washing your hands very well and wearing a mask during preparation of that food. But we do highly recommend that you try and let somebody else prepare that food. If you are, in fact, positive, somebody from the health department will contact you and give you more information. They will offer to mail you information or email you or text you information more specific to your individual case and more specific to your family. And then they will also collect information from you, which we're going to get into in a little bit here. If you are negative, you will also be contacted here in Genesee County. For our testing at Shiloh, you have the option of either being mailed your negative results, being emailed your negative results, or being texted your negative results. And then there is also a phone number that you can follow up with. All of the testing sites, the Kroger's, the Rite Aid, everything, they all give you a sheet when you test, or they email it to you of what you should do, what you should expect, when you should get your results back, and who you should contact if you haven't received your results yet.
So Kim, while you're at this point, you may be able to answer this, or it may even float over to Dr. Reynolds. But one of the questions is, for the Shiloh testing, is it for Flint residents only?
No, it is Genesee County wide. And since you brought the subject back up, we have just been notified that the MTA is offering free rides to the Shiloh testing. So we will also have a walk-up test tent available.
Okay, that's great. While we're at this point, we've got in testing, I see that Clarence Pierce is on the line, at the CEO of Hamilton Community Health Network. Before we go to the contact tracing conversation, Clarence, are there any updates you want to give us with respect to the testing for Hamilton?
Well, thanks again, Yvonne. I would like to give an update. One, the Burton location will be moving starting Tuesday to the fire station there at Bristol and South Saginaw on 3093 Coin Street, Coin, C-O-I-N, Coin Street in Burton, Michigan. We will be set up there in the fire station, so it'll be a little more convenient for the folks who want to be tested as well as our staff. Also, I did want to mention, Yvonne, that we will be making an announcement on June 8th. We are partnering up with Meridian Health Plan and Certainteen Corporation, and we'll be providing both tests. That's the PCR, serology test, and the nasal swab test. And we will be doing that for any and everybody in the community. They will not have to call and make an appointment. They will not need to sign up. We will take care of all of that on site. And we will be looking forward to having people come out and get tested. Very similar to what was being done at the Shiloh Baptist Church over the weekend. We feel that it is vitally important to get as many people tested as possible, and having this relationship with Meridian and Certainteen certainly put us in a position to get everybody tested without them having to go through any type of procedure or call in. So we're really excited about that and looking forward to working with them and getting everybody tested.
Thank you so much, Clarence. That's really a critical conversation, because we have had some people indicated there were some challenges, and I appreciate, and I'm sure the community appreciates both of these efforts to make it more accessible. Now, between you and Kim and Dr. Verholden, there's another conversation we're going to have. We won't be able to have it today, but there are questions about these tests. You mentioned the nasal, and there's two different kinds, and then we've got the serology, and then there's a question in the queue about antibody tests. What is it? Where can we get it done? And we're gonna put this in for a future session. So I want all of you that are listening to know we pay attention to your questions, and we're gonna be sure we can come back and give you an update on this information. So thank you so much for that. So Kim, can we talk a little bit? We really want to focus in on the whole issue of contact tracing, because once the testing is done, and you mentioned that during your previous conversation, when a person is tested positive, there's going to be a contact with that individual, but also others who have been in their presence. So can you tell us what this process is? And of course, it isn't new, but for the world, but it may be new for some of us who've never had to experience this before.
Yes, that's exactly right, Yvonne. So you can see on this first slide here, this is what the health department does on a daily basis. And the red box there, disease and injury prevention, includes outbreak investigation. We do outbreak investigation. If you want to go ahead and switch over to the next slide, we do outbreak investigation for all sorts of communicable diseases. Some of the things that you might be familiar with, we've done HIV investigation, other STI investigation, chlamydia, gonorrhea. Foodborne illnesses are included in that outbreak investigation. So the Hep A issue that we had a couple years ago and into last year also is considered an outbreak investigation. So part of that outbreak investigation is the actual case investigation. Go ahead and flip to the next slide there for me, thanks. So Genesee County Health Department is taking care of the case investigation process for COVID-19, just like we do for all of the other diseases. Recently, this weekend, there was the beginning of this week, there was a media release about a rabid skunk. If somebody gets bitten by a skunk and we're researching a rabies case, we do a case investigation. So just like that with COVID-19, all of the positive cases, we're going to do case investigation. So what do we do first? If a person is tested, they're considered a person under investigation for COVID-19. So they are made a case in the state's database. The state has a database for disease reporting. It records all communicable diseases. So any type of disease that is reportable, measles, chickenpox, the flu, all of those are kept in our Michigan disease surveillance system. So if you have a test done and you're a person under investigation, you will be entered as a case in our disease surveillance system. The next step is whether or not your test comes back positive or negative. If your test comes back negative, you're just easily marked not a case and you're notified and all go on their way. If you're positive, then one of our COVID team members at Genesee County Health Department will call you and will ask you several questions while they're doing their investigation. First of all, they're going to want to verify that they're talking to the right person. We don't like to share personal health information with people that aren't supposed to know it. So we want to know that it's really you. We will ask you your name, your date of birth. We will want to verify your phone number and your address. We need a current phone number and a current address in case we should need to follow up with you and get you other information. Some other things that we might ask you: when did it start? We need to know when you started having symptoms so that we can help you figure out who you were around and who you might have exposed. That begins your contact list. We'll get more with that in a minute. We also like to know what type of symptoms. Did you have the typical symptoms? Did you have the cough? Did you have the shortness of breath? Did you have a fever? Or did you have some of those odd symptoms like loss of taste? We help research all of those things by putting them in the disease database. We report them to the CDC, and that's how the CDC grows the symptom list so that physicians know when you come in with loss of taste, they should be testing you for COVID-19. We like to know how long you've had those symptoms. We like to know, and we'll follow up sometimes, and want to know when your recovery period is. That helps our reporting also, so that you as a community know how many people have recovered from COVID-19. Like I said, because of all of these questions, we will help you figure out who you've been around, and were they sick? Were you exposed from somebody else? Have you exposed somebody? Have you done any travel? Again, we're looking for your point of contact. How did you get this? And then what is your past medical history? Things like asthma, things like diabetes, any chronic health, underlying health issues could put you at a higher risk for recovery time with COVID-19. So we like to take all of that into consideration. One, we keep that for part of our research, and two, that helps us educate you on how you need to help take care of yourself. And then we will provide you with education, we will provide you with the information, we will provide you with resources. We have resources for healthcare, we have resources for helping you sign up for insurance, we have resources for helping you find a medical home. And then finally, we record the contacts that you've given us, the people that you feel were exposed during the time that you were sick, and that goes into a list. The state then pulls that list for the contact tracing. Go ahead and switch. There we go. So calls for case, before we go into the contact tracing, if you get a call for case investigation from a Genesee County Health Department employee, there are two things that might show up on your caller ID. If the employee is calling from the office, then you might see GCHD scrambled number, something like is on the screen. we do that for the protection of our employees, obviously. Many of our employees, however, are working from home and they're using call apps like Google Voice. Google Voice is something you can sign up for, and you sign up for a local number and it gives you a random number that you can call from. And then it would show up on the caller ID just like a regular 810-414-424-6792, any random number. So we want you to please answer the phone, okay? Because it could be us from Genesee County calling, and we're trying to do these case investigations and help get you the information that you need. Don't be afraid to ask them questions. They should be able to answer what is the information that you need. Why do you need that information? And what are you going to do with my information? Those are all very valid and very important questions. So don't be afraid to ask those questions of the person that's on the phone with you. Any employee from Genesee County should be able to answer those questions to your satisfaction. If a person is working from home, they also will have an office number that they should be able to give you, and you should call that office number to confirm that it really is that person's name on the voicemail. So that's another way that you can check and verify to make sure that this really is a Genesee County employee that you're speaking to. If all else fails and you still really are unsure and you really, really want to double check because this just doesn't seem like an authentic call to you, then you can call our COVID line, 810-424-4443. And the operator that answers that call has access to a Genesee County employee list. She can check the list, verify that the person who called you is definitely an employee of Genesee County Health Department. So go ahead and flip over, there we go. So as far as the contact tracing calls, MDHHS, which is Michigan Department of Health and Human Services, is handling the contact tracing for the state, for the county. So their calls are to notify individuals that they have been exposed to a person who is a positive COVID-19 case. They also will want to make sure that they're speaking to the right person. So they should ask your name and your date of birth, because again, we don't want to share personal health information to the wrong person. While they are talking to you, they will ask you if you have symptoms or other health issues. We like to make sure that you're not becoming sick. And if you do have symptoms, then they have instructions to forward your information on to one of the nurses at the health department so that we can follow up with you. They will also ask for a phone number and address in case we need to follow up with you, or in case additional information needs to be mailed to you. They may also, I didn't put it on this slide, but they may also ask for an email. With people being transient and moving a lot, sometimes emails are more reliable than phone numbers or addresses. We tend to keep email addresses for years, even though we might move or might get a different phone. One of the other things that the contact tracers will ask is whether or not you want to sign up for a texting app that allows them to monitor your symptoms for 14 days, or if you want to be called every day for 14 days. So they will call you for 14 days to check in on you and find out daily if you are developing any symptoms. So have you developed a temperature? Have you developed a cough? Do you have shortness of breath? All of the same questions that they asked you on the first day, they'll ask you for 14 consecutive days. The reason it's 14 days is we know that once you're exposed to COVID-19, between day 2 and day 14 is when you're likely to develop symptoms if you're going to become positive. Okay, go ahead and flip over to the next. Oh, you know what? Something that I deleted off of the screen before you flip over is that My COVID Help. We talked about that last week. If the state calls you, anybody that's calling from the state as a contact tracer will show up on your caller ID as MI, short for Michigan, COVID help, HELP. So that's what you should be looking for the contact tracing. Okay, go ahead to my last slide. No agencies, Genesee County, Michigan Department of Health and Human Services, contact tracers will ever ask you questions about financial, tax, or social security information. That is a very, very big point to take home. This is what all of the scammers are looking for. So if you're ever on a call, you thought it seemed like it was an official call, but then all of a sudden they start asking you questions about your bank status. It's not official. Hang up. Stop talking to them. So if they're ever asking you financial, tax, or social security information, it is not a call from Genesee County Health Department or from the state of Michigan. What other questions do you have for me, Yvonne, and what did I miss? Oh, I lost my sound.
Thank you, Kim. You did a great job. We appreciate the information. It was very detailed. We wanted the listeners to hear what you had to say. And so please pay attention. No financial information, but it is important for us to answer that call. So thank you, Kim. Another really important thing, and I do want to encourage you, if you've got questions, put them in the queue right now. Our team will stay on following the webinar to answer any questions that you put in the queue. One of the things that's also critical for us is to know that we've got a work group, and Dr. Deborah mentioned our task force earlier, that's specifically looking at how we can make sure we have a local connection. And Kirk Smith, the CEO of the Greater Flint Health Coalition, is partnering with the health department to work on this work group. He's going to just give us a really quick reminder about that, but he's also going to talk to us about the importance of a medical home. So Kirk, please share with us for the next couple of minutes or so the importance of this idea of local contact and the importance of a medical home.
Hi, Yvonne. I'll be quick because I know we don't have a bunch of time. Like we mentioned last week, we developed about a month ago a local contact tracing work group that was formed in partnership between Kim and the team at the Genesee County Health Department, the Greater Flint Health Coalition, and a number of community-based partners. Our goal has been to work hard to develop and grow a local contact tracing volunteer workforce. As Kim alluded to, many of these calls are conducted in partnership with MDHHS, and they're conducted by volunteers. We want to ensure that we have volunteers that are adequate in number to make those calls now, as well as if those calls need to be increased in future periods, that we're prepared. And volunteers make that possible. So together with not only the Health Department and the Health Coalition, we have the City of Flint, Genesee Health Plan, Genesee Health System, Wellness, New Paths, the CHAP program, as well as United Way and Michigan State and others working together to identify local volunteers and to get them into the queue so that they can support this work that Kim has described. Interested volunteers really have to complete a 4-step process. The first step is to register on the state's public health volunteer website. The second step is to complete an online training through the state of Michigan. The third step is at the end of that training, a confidentiality agreement is signed that the individual is then prompted into a period of time where they will wait while the 4th step of a background check is completed. As Kim alluded to, everything is under the umbrella of confidentiality, and these steps make sure that every contact tracing volunteer is well informed, well trained, and ensures that no information that shouldn't be shared is shared. We want to make sure that we identify the individuals, speak to them about their risks, and make sure that we protect their health. Based on that process, once the 4 steps are completed, at that point, the MDHHS firm that oversees all the contact tracing volunteers will reach out to individuals and put them into the queue as needs for additional volunteers arise. We can share those links either at the next webinar or in the chat if anybody's interested in that. Happy to elaborate on it.
Thanks, Kirk. We would definitely make sure we get that information out. So can you quickly tell us about what the Health Coalition is doing with respect to helping to ensure people have a medical home?
On the screen, you'll see a flyer specific to the Greater Flint Health Coalition and the Community Health Access Program, or CHAP. CHAP has been in existence for about the past 5 years, and its first purpose was created to make sure that any individual in Flint and Genesee County has a connection to a medical home. Originally, the program worked with children in the community. That expanded a couple of years ago to work with both children and adults who may or may not have a medical home. CHAP has relationships with about 50 different medical homes or primary care physicians, family practices throughout Flint and Genesee County that an individual can be connected to. The concept of a medical home is that this is where we go not just for sick care, but for well visits, for testing, for specialty care, for preventive services, for immunizations. If anybody has a need or does not have a place where they go for regular medical care, CHAP can assist with that. A community health worker will be available to you to see where you would like to go, the type of coverage you have. If you don't have coverage, they can assist with that. And as we see on the screen, anybody who needs assistance, there's numbers for calling. You can text, you can email, and CHAP will assign a community health worker to work with you to help establish that medical home.
Thank you, Kirk. Now, for those of you that are listening and you don't see the screen, the number I want to give you to call for CHAP is 810-953-2427. Again, that's 810-953-2427. And I know someone will be ready to answer that call for you. As we are moving to the close of our webinar today, I want to remind you that other community partners that are not able to share with you, they are waiting to get questions from you right now while we are speaking. In addition to needing a medical home, we know that people still need health coverage, and the Genesee Health Plan is available to assist with supporting residents of Genesee County who need health coverage, whatever that health coverage might be. You can call them at 810-232-7740, 810-232-7740. And other partners like Hamilton and the Genesee Community Health Center, they're also willing to assist if you need coverage and you show up at their facilities. We want to remind you that the City of Flint is continuing to work. I know they're on the line. They can answer questions. We have a blue ribbon committee that's working on reopening our community, and that's one of the reasons why this testing is so important. I want to invite you to tune in, and hopefully next week we'll be able to spend more time on this blue ribbon and what's happening right here in Flint with respect to reopening our communities. I just want to give a shout out to Brian Larkin. I see that he was on and wanted to know if, Brian, you wanted to just chime in a statement and let us know what's going on with the Blue Ribbon Committee.
I'll cede my time to Dr. Reynolds, and then when we have more time next week, we can go in detail.
Okay, I got you. You're gonna be here next week. All right. Dr. Reynolds, if you want to wait till next week as well, you can help me with the MTA conversation we had earlier today. How important it is that our Mass Transit Authority is working with us to ensure that the residents of the Flint can get the services that they need.
Well, I'd like to start off by talking about using that number 810-410-2020. If your water was shut off months ago and you want to reconnect, call that number, please. Because we must be able, as Dr. Furholden said, we must be able to wash our hands. Okay, and wash our clothing and our dishes. It's basic personal hygiene and home sanitation, and that is the foundation on which we build, and then we go on to wear your masks. The curfew ended yesterday, the 28th. However, stay home, stay safe is still the mantra. So avoid unnecessary trips And still, you've heard me say it before, if you're going shopping, you don't have to take everybody. If you need someone to help you, take that one person. If you can get your groceries delivered, try that. Uh, but we must continue to be vigilant. The only reason deaths reached, and I don't mean to offend anybody when I say this, only 100,000 is, and I mean to compliment folks who have cooperated. The only reason we have been able to flatten this curve is because we have observed these things: social distancing or physical distancing, wearing a mask when we go out, and staying home and staying safe. But please, if you have a pre-existing medical condition, contact your doctor. If you don't have a doctor, you can call the Genesee Health Plan. You can call Hamilton, and you can get connected with care, because COVID-19 is not the only condition out there. Thank you.
Thank you, Dr. Reynolds. Thank you. I want to remind us that MTA has opened its services. Call this number if you need a ride to any of the testing sites, 810-767-5541, 810-767-5541. MTA will be able to take you with your ride. There is the fee is still there for your ride, but please call them. Our time is up today. I want to thank you for joining us. Please submit those questions. One of the big things is, what is the issue with reopening? Join us next week and we'll talk more about that. Please complete your 1-minute evaluation that will pop up immediately following the webinar. If you are not on the webinar, please send us an email to the www.hfrcc.org and let us know what your responses are. We want to thank you again today. Join us next Friday at noon for the community webinar on coronavirus. See you next week.